Hello, I'm Tony DeMaria, the editor of JACC, here to tell you about some really interesting articles that are going to appear in the February 28th issue of JACC. And the first one deals with the topic of the long-term efficacy of drug-eluting stents. And this is a 5-year follow-up. There haven't been too many 5-year follow-ups of the first-generation drug-eluting stents. And in this particular study, what they were interested in looking at was the number of events that occurred and whether they occurred or could be attributed to the target vessel that received the drug-eluting stent or progression of disease in some other vessel. And in fact, over a 5-year period of time, there was a considerable increase in the number of events. There were about 25% of the patients had events, about 10% death, 8% MI, and the rest revascularization. And what was interesting was about half of these events plus the appearance of perfusion defects on radionuclide scan were due to the initial target vessel, and the other half were due to progression of disease in other areas. So the take-home message is that after 5 years with drug-eluting stents, there's still a considerable number of events, and that they can occur as much in the target vessel as progression in other disease. Now, another study in that issue that really was of interest related to the use of allopurinol in patients with congestive heart failure, and specifically using MR spectroscopy to look at myocardial energetics in response to allopurinol. And we know that allopurinol, by inhibiting the degradation of ATP and purine metabolism, could potentially increase the ATP levels in the myocardium and enhance contraction. And in this particular study, in a relatively small number of heart failure patients, that's exactly what they observed. So an interesting mechanistic study and perhaps the basis for using allopurinol or other such drugs in our heart failure patients. The last study dealt with the interesting issue of viability and its role in predicting the success of revascularization. And as opposed to the STITCH trial, this study used magnetic resonance imaging. And what they found was that if there was evidence of viability by magnetic resonance imaging and patients were treated medically rather than with revascularization, they did substantially poorer. Now, if the patients underwent revascularization, it didn't seem to matter whether they had viability by MRI or not. They did equally well. So the take-home message, again, is that this issue of viability is not totally settled. There's still a number of questions, and in using delayed enhancement by MRI, if a patient has evidence of viability, these data would suggest they probably should undergo revascularization. There's lots of other good material in the issue. I encourage you to read it. For Inside JACC, I'm Tony DeMaria.